Hi, everyone. Welcome to RxConnect. This is a podcast brought to you by the Pharmacy Operations Department at American Oncology Network. And I'm your host, Cassie Perkey. I'm one of the board-certified oncology pharmacists here at AON. And RxConnect is a monthly podcast where we break down updates in oncology pharmacy, as well as practical tips for patients managing common cancer treatment side effects at home. So in this series, we'll be talking with pharmacists and other providers who work closely with patients every day so that you can feel more informed and more confident during treatment. Before we get started, just a quick disclaimer, this podcast is intended for educational purposes only. We may discuss medications that have off-label uses, and this is not to be taken as medical advice. Every patient situation is different, so please always talk with your provider and pharmacist before making any changes to your medications or your care plan. This RxConnect podcast episode is supported and sponsored by educational funding provided by Eli Lilly and Company, and information provided is for educational purposes, and the views expressed in this episode are our own and not influenced by Eli Lilly. In recent episodes, we've talked about managing common side effects from chemotherapy, particularly focusing on what's going on with our GI tract while on treatment. So today, we're continuing that conversation by zooming in on another common side effect, and that's diarrhea. So whether it starts right after treatment begins or if it shows up later on, diarrhea can be really frustrating and uncomfortable. And as pharmacists, we hear a lot of patients asking about what the right thing is to treat it, how long it's going to last, and when it's a big enough deal to bring it up to their oncologist. So today I am joined by Dr. Hayley Reed, and she is a clinical oncology pharmacist who works with our specialty pharmacy here at AON. And she helps patients start and stay on oral cancer therapies and has a lot of experience supporting people through side effects like this. So she's here to share some practical strategies and tips that you can use at home to feel more confident managing diarrhea during treatment. So thank you so much for being here, Hayley. I just want to get started with one question. What are some of the most common oncology medications that tend to cause diarrhea? And about how soon after starting treatment can patients expect this type of side effect to start showing up?
Well, thank you so much for having me, Cassie. And while certainly not an all encompassing list, some common oral drug classes that are associated with a significant risk of diarrhea include our tyrosine kinase inhibitors, KRAS G12C inhibitors, EGFR inhibitors, and CDK4/6 inhibitors like Verzenio or abemaciclib. The onset of symptoms can vary across agents, but may begin as early as 5 to 7 days after initiating therapy.
Yeah, so across the board, I feel like it's safe to say that diarrhea is definitely one of the more common things that we can see with GI or gastrointestinal type side effects. So you had mentioned Verzenio or abemaciclib, and I know that's a very commonly prescribed medication for breast cancer. But like you said, diarrhea is one of the more prominent side effects with that drug. How often does diarrhea occur with Verzenio or abemaciclib, and how long does it take to appear? And is this something that patients can expect to experience throughout treatment?
Right. So, as you mentioned, diarrhea is the most commonly reported side effect of Verzenio or abemaciclib across clinical trials. It occurred in upwards of 81 to 90% of patients, though the more severe grade 3 diarrhea was seen in a smaller proportion, roughly 8 to 20%. The onset typically happens fairly early, with a median time to onset of around 6 to 8 days after starting treatment. Fortunately, in most cases, these episodes do resolve within 5 to 11 days, depending on severity, and especially with proper management like antidiarrheals and dose adjustments. It's important to note that for many patients, diarrhea tends to improve or stabilize over time. So while it's certainly something to be aware of, it doesn't necessarily persist at the same intensity throughout the entire duration of treatment.
I like that you mentioned that it's something that tends to improve over time. I feel like that's something that's misunderstood by a lot of patients on this drug for breast cancer that, it's not, it may be more towards the beginning, but hopefully we can find a way to stabilize that, and then over time we should see that decrease. But then when you're counseling someone on starting Verzenio or abemaciclib, what do you usually tell patients to do about treating diarrhea when it happens? Do you have patients start taking antidiarrheals preemptively, or do you end up taking more of a reactive approach?
So, when counseling patients starting Verzenio or abemaciclib, we take a proactive but balanced approach to managing the diarrhea. We typically advise patients to begin taking loperamide, an over the counter antidiarrheal, at the first sign of loose stools, starting with a 4 milligram dose initially, followed by a 2 milligram dose after each subsequent loose stool, up to a maximum of up to 16 milligrams per day. To support this, all of our New Start Verzenio abemaciclib kits include a sample box of loperamide for patients to have on hand, along with a printed guide on managing diarrhea. In addition to antidiarrheal medication, we counsel patients on dietary adjustments as well. Some things as simple as avoiding food and beverages that can worsen diarrhea. And we stress the importance of staying well hydrated, typically encouraging and aiming for 8 to 10 cups of water daily. You mentioned about potentially prophylactic use, and we generally avoid recommending prophylactic loperamide use as it can lead to constipation, particularly in the small subset of patients who may not go on to develop significant diarrhea. Now, having said that, I have seen some providers consider short-term prophylactic use, especially during that first 1 to 2 week window of therapy, for those patients that we consider higher risk of developing diarrhea. So maybe those with a history of GI sensitivity or maybe previous severe diarrhea from similar agents.
That's really neat that in your like starting kit for patients that are going to be starting on Verzenio or abemaciclib, that you have that guide and even include the loperamide, or brand name would be Imodium for that one, including that with or for those patients that are going to be starting. So I didn't realize that that was a resource that they were able to receive. So I feel like that's great. They already have all the tools there ready to get started. Can you talk more about what prescriptions doctors might send for treatment of diarrhea that's related to chemotherapy, and what kind of side effects should they be looking out for with those drugs?
Well, as I mentioned, the over-the-counter loperamide or Imodium is typically considered the first-line treatment for chemotherapy-related diarrhea. Beyond that, we often see prescriptions for agents like Lomotil, which is the combination pill of diphenoxylate and atropine, octreotide injections, and cholestyramine packets. In rare cases, I've even seen opium tincture, but those are typically reserved and used in refractory situations. Each of these medications come with its own set of side effects. As you would probably expect, constipation is the most common across the board. But with diphenoxylate, atropine, or Lomotil, can also cause drowsiness and dry mouth, while octreotide, which is given by injection, may cause some injection site reactions, abdominal pain, and cramping. The cholestyramine packets can lead to bloating and may leave an unpleasant or even gritty taste in the mouth since it is a powder that you mix. And while not a side effect per se, something to mention about cholestyramine is that it can interfere with the absorption of other medications. So it is important to review a patient's full medication list before starting that one. Being mindful of these potential issues helps us tailor the approach to each individual patient and optimize both symptom control as well as safety.
So with the like cholestyramine and even some of these other prescriptions for patients that are listening, definitely make sure that whatever pharmacy you're going to fill these prescriptions, that they know about any other medications that you may be taking or that you're taking. So make sure they have your full prescription list so they can do an interaction check and make sure that they can give you any special instructions, like if you need to adjust the timing of any of those medications as you're getting started. So, Dr. Reed, when should a patient consider diarrhea serious enough to report that to their oncologist? And what kind of symptoms would you be advising patients to be thinking, that's probably a red flag. We should probably give somebody a call.
We tend to encourage patients to contact their oncologist if their diarrhea is persistent or severe. And what I mean by that, we define that as 4 or more loose stools per day despite loperamide use, or diarrhea that lasts more than 24 hours. You mentioned some symptoms that might raise a red flag and warrant immediate attention. Some signs of dehydration, we encourage patients to look out for. So, dry mouth, dizziness, reduced urine output, or maybe darker colored urine. We're also concerned if patients develop fever, blood in the stool, or experience severe cramping or abdominal pain. It's always better, in my view, to err on the side of caution and reach out sooner rather than later, especially during chemotherapy. Even common side effects like diarrhea can become pretty serious if it's not addressed early.
So on that same thought, for patients that may be hesitant to bring up side effects like diarrhea, what would you want them to know? Because clearly, like, dehydration can become serious pretty quickly. So why is that early communication so important?
So we understand that talking about side effects like diarrhea can feel uncomfortable or even a little embarrassing, but it's important that we tell patients you're not alone. These symptoms are actually very common with certain cancer treatments. We want patients to hear this message. Early communication is key. Untreated diarrhea can lead to serious complications like dehydration, electrolyte imbalances, or even treatment interruptions. So, the sooner we know what's happening, the sooner we can step in with effective management strategies that can help patients, feel better and keep their treatment on track. We encourage patients to be prepared by keeping loperamide on hand before starting treatment. We remind patients that managing side effects is a normal and expected part of cancer care. Patients are not bothering us. This is exactly what we're here for. We want their treatment to be as safe and tolerable as possible, and we can only help if we know what's going on.
Thanks for that, Dr. Reed. And as we just wrap up with this episode, I really liked what you mentioned earlier. Uh, Something with the dosing for loperamide or Imodium, that you can take 2 milligrams at a time up to 16 milligrams in a 24-hour period. So that's as many as 8 doses. So I feel like in my experience too with patients, they may be you know, they may be not taking very much of the Imodium. So understand that you can be taking as many as 8 pills in 24 hours. So don't be afraid to take another couple up. And when you're getting up to that upper limit, then that's another reason to give your doctor's office a call, or call your pharmacist. But I feel like that's another just common misconception that you take maybe just a couple doses of Imodium and maybe it's not working, but maybe there's some fear with taking more of it. So I think it's really good to know where that limit is. So up to those 16 milligrams within one day. But that is all we have for this episode of RxConnect. Thank you so much, Dr. Reed, for being here and sharing your expertise on treatment of diarrhea and providing patients with these practical tips that they can easily implement at home and make side effects like these much less daunting. I know this is a really big topic, and there's so much more that we could discuss about diarrhea with all the different kinds of treatments out there. So, if you are starting on a medication that commonly causes diarrhea, or if you're currently on treatment and you are experiencing diarrhea, make sure you talk about this with your oncologist team. Don't be afraid to bring it up. That's what they're there for. And bring it up with your pharmacist as well so that they can get a plan in place to manage it and tailor it to your specific case and your specific treatment regimen. So thank you so much for listening. We will be back next month with another topic to help support you during treatment. And if you found this helpful, we'd love it if you shared this episode with a friend or a family member.
The RxConnect podcast is produced by the pharmacy operations team here at American Oncology Network and music composed by the Synth Dude. Make sure to check out all our episodes of the podcast by liking and subscribing to our YouTube channel.